most of the trauma-focused therapies that have been validated for use with our folks who are suffering from PTSD involve some kind of measurement-based care built in. And often that is the PCL. And so it's administered at the beginning of every session to gauge where patients are at that session. Now, I personally like at the beginning of treatment to give them the PCL. And then as we're going through the psychoeducational component of the treatment, which is, again, another pretty standard part of every one of our treatments, really explain to them how the symptoms that I am talking about actually map on to the symptoms that they've answered. And I like to talk to them about what we're going to hope to see over the course of our treatment. So, for example, one of the things that we typically chip away at first for all trauma-focused therapies are those C items, right? Those are the avoidance items. And we are having them come into treatment and answer questions about their trauma. And so the avoidance is decreasing. And so we want to see that on the PCL. And usually by decreasing the avoidance, which has served for protecting them from some of these other memories, we see some of those other symptoms go up. And so explaining to them, this is what they can expect over the course of treatment. And then at each session, being able to point out where the symptoms are going, talk to them about places where they're noticing having trouble, can be really helpful and can really be a useful tool for them to be able to communicate with us as therapists about where they're suffering, how the treatment is or isn't working. And then at the end of treatment, it can be really helpful to give them a graph of their symptoms so that they can see how they've reduced.